Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. Going to be speaking this evening with returning guest, Dr. Adriana Carrillo, joining us to talk about the immunotherapy emerging treatment for children who are at risk for type 1 diabetes. Welcome back, Dr. Carrillo. Thanks for joining us again.
Thank you so much. Very nice to come back.
Well, for our listeners who weren't here to hear you when you were here before, give our listeners a bit of your background. Tell us what it is you do and where it is that you do it.
Oh, I'm a pediatric endocrinologist attending at Nicklaus Children Hospital in Miami. I also hold an associate clinical professor voluntary at Florida International University, and I've been working in pediatric endocrinology for about 20 years already. Some on research in the past, and now I do clinical research and clinical care.
Today, we're going to talk about some emerging treatment involving immunotherapy for at-risk children and type 1 diabetes. Explain to our listeners the prevalence of type 1 diabetes in children.
So type 1, it's quite prevalent and it's becoming more frequent. So there is a risk of 1 in 300. So the prevalence is about 1 in 300 in children and adolescents.
Type 1 diabetes, it can be controlled. Is that with insulin or without? Explain the difference between type 1 diabetes and type 2.
Okay, so type 1 diabetes, it comes from the significant destruction of the beta cell that produce insulin, while type 2, it's basically given initially at least for insulin resistance, so there is production, but eventually there will be destruction, although no autoimmune of the beta cell.
Now, normally for children with type 1 diabetes, what is the ongoing treatment?
So the treatment for type 1 diabetes, it's a multidisciplinary treatment, but in terms of medications, we use insulin through multiple injections or through insulin pumps that nowadays we have a new technology using the closed loop, the hybrid closed loop, meaning that the pump holds an insulin and can connect to the Dexcom or any of the sensors, and they will provide in a hybrid way adjustments of the insulin according to the blood glucose. There's also the insulin pumps that are managed manually. That's the treatment basically in terms of insulin therapy. And when you we talk about our topic, right, was basically to talk about the immunotherapy for relatives of patients, children or patients in general with type 1 diabetes. And this will come as an eventually emergent therapy to preserve the beta cell destruction and to prolong the time of presentation of clinical diabetes. As we talked about before, I guess in our last conversation, type 1 has different phases. So there's a phase in which there's just there's a presence of antibodies without dysglycemia, what we call without having abnormal blood glucose, and that's called the phase 1. The phase 2 is when there is presence of antibodies and there is dysglycemia, so the patient either has some high blood glucose but not yet clinical diabetes. So the emergent therapy will come for patients or people at risk, relative of type 1 that has at least 2 antibodies, and this therapy, which is monoclonal antibodies, is called anti-CD3 monoclonal antibodies, and specifically we're talking about teplizumab. There was a study that was published in the New England Journal last year, and it was included about 76 relatives of type 1. And with the use of this medication, which is given as an infusion for 14 days, they demonstrated how the time of presentation of clinical diabetes in these individuals who were at high risk, it was prolonged from to 44 months to have diabetes versus 24 months in the study group, or the group that received the placebo. So this was very important because for the first time it was demonstrated that this therapy will prolong the presentation of clinical diabetes. And eventually this therapy, if it's approved by FDA, could be available for patients at high risk for type 1 diabetes.
Well, where can our listeners go online and get some more information about this emerging therapy and about Nicklaus Health as well?
So you can look for teplizumab, and the company that now it's working on that is called Provention, and you can find more information about this medication and the trial obviously in the New England Journal in November 2019.
And I do believe the website for Nicklaus is www.nicklaushealth.org. That's NICKLAUSHEALTH.org. Well, I appreciate you returning, Doctor. It's always a pleasure, and I'm hoping we'll speak again soon, okay?
Okay. Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au.